U.S. Surgeon General now calling for labels on alcoholic beverages, warning about the increased risk of at least 7 types of cancer. Alcoholic beverages currently have warnings about birth defects if consumed by pregnant women. Dr. Murthy is calling for an updated warning label to include cancer risk. According to government data, alcohol is responsible for 100,000 cases of cancer each year and 20,000 cancer deaths. Advisory from the Surgeon General are reserved for urgent public health issues. Dr. Murthy was previously issued calls to action on mental health, firearm violence, and social media. For years, there has been a back and forth debate over whether drinking some types of alcohol, like wine in moderation, might have some benefits. Joining us live now is Dr. Judith Hahn with UCSF, who spent years researching alcohol use and the impact on the human body. Thank you so much for joining us this evening. Dr. Hahn, I want to ask you, from your experience, is there any amount of drinking or an alcohol type that can have positive effects?
Well, certainly. Most people who drink alcohol drink it because they enjoy it. They drink it to help cope with stress. But then when we start to look at the long-term health effects, we are finding more and more concerning evidence. And what I think the Surgeon General wants people to understand is that it does increase the risk of many types of cancer. And that's not something that most people have recognized in the past. Most people think about alcohol causing liver disease or you to be in fights and violent, but the cancer link hasn't been as well understood, and there's more and more evidence that cancer is one of the things on the list that is caused by alcohol. In particular, the most concerning is breast cancer, which is the most common form of cancer in women, and women have been having more and more alcohol use over the years. They're starting to catch up with men in their drinking, and as they get older, it gets to be even more problematic in terms of the health risks. So I think the Surgeon General, in pointing this out and wanting it to be on the labels, wants people to understand that, yes, there may be reasons to drink alcohol in small amounts, but we really do need to be aware that there are health risks.
Yeah, book clubs for women and wives always come with a bottle of wine. So
exactly.
We can see how that can happen. And we saw a big increase in drinking during the pandemic. And for some, it has continued. What kind of other health issues do you typically see with more increased alcohol consumption?
Well, there's certainly, there could be cognitive decline as we go up in age and drinking alcohol. There's certainly social risks. It can affect relationships. It can affect people who want to try to maintain a healthy weight. It has a lot of calories. So there's, I think alcohol is known to affect 200 different conditions in the body. So I can't list them all, but there's a lot of risk that maybe offsets the benefits that people feel when they drink alcohol.
Now, while you said that there might be an increase in drinking among women, recent studies have found that drinking among young people is actually on the decline. Have you seen any changes in people's attitudes towards alcohol over the years?
I think that, we know, like I said, the increases in women among older women. I think that in my, personal experience, it has become more socially acceptable for people to have alcohol at home, have it on a very regular basis. And that's when it becomes problematic, when it starts creeping up with people not even realizing maybe how much they are drinking. When you see, they might not count, but there may be quite a few bottles of wine in that recycling that they need to pay attention to. So I do think attitudes have become more permissive, especially maybe in certain socioeconomic groups. And certainly there's so much alcohol in the media. And in my lifetime, I do feel like that has been on the rise.
All right, Dr. Hahn, thank you so much for your insight. For those that have been drinking for a while now and now get this warning, is it too late for some of us?
It's definitely not too late to have good health behaviors.
All right. Thank you, Dr. Hahn from UCSF.